Knock, knock. Hi, Debbie. My name is Carl. I'll be your nurse today, washing my hands. Can I just please have you verify your full name and date of birth for me, please, Debbie? You got Debbie Michaels, 5/18/2006. Checking that on her wristband. That matches. So, Debbie, because of your nauseousness that you're having, the doctor has ordered some ondansetron Zofran, which can be given 2 milligrams IV push every 4 hours, PRN for nausea. I see your only allergy is hydromorphone, and that you've received this before, but not within the last 4 hours. Did you have any adverse reaction last time you had that? Any diarrhea, headache, fever, anything of that sort? She says no. So that's good. I will wash my hands, put on gloves. I'm just going to check the site here quick. No tenderness, swelling, redness, edema, infiltration. Everything looks good with your PICC line. She does still need to have that because of her meningitis. She needs IV fluids and antibiotics. I have my 3 flushes and my Zofran here. Just going to go ahead and get my flushes primed, get the air bubbles out.
Get that out of the way. Throw it in the garbage. Not dropping your hands below this level. So now we can go ahead and
I suppose I can pull for privacy if need be, if she's not in her own room.
And then we can go ahead and grab
the expiration date is good on all of my flushes.
So you're going to go ahead and get the majority of
and I have checked in the med book, and the Zofran does not need to be diluted and is compatible with saline flushes. So I don't need to do any vital checks to give Zofran. Really, it shouldn't mess with her vital signs at all. It can cause diarrhea, headache, and fever, so I'll be wanting to monitor for that as I'm giving it. But she didn't have any complications prior, so I'll do my first 5 rights check. I have my Zofran 2 milligrams per 2 mLs. Expiration date is good. We have Debbie Michaels, 5/18/2006. Zofran, she's to get 2 milligrams IV push every 4 hours, PRN for nausea. She has not gotten that yet, and we'll be giving it now. So I'm going to get dose accurate according to my calculations. This is 5 milligrams per 2 mLs. She's received 2 milligrams IV push every 4 hours, so 2 milligrams would be 0.8 mLs. So I'm going to waste until I'm at the accurate dose.
Make sure you use lots of friction. Just close it that. And then you would let that air dry.
Okay.
And then you would
recap this, and ideally I would put another label on here with the proper dose to make sure I'm dose accurate in case I got called off, sidetracked, and I didn't get to give it to her right away. I would know that I still had the right dose here and the right medication. So now I can do my 5 rights checks 3 times. I have Debbie Michaels, 5/18/2006. I have Zofran, 2 milligram IV push every 4 hours, PRN. She's not had it. I'm going to give it now through her PICC line. I'm dose accurate at 0.8 mLs. Debbie Michaels, 5/18/2006. I have ondansetron Zofran, 2 milligrams IV push every 4 hours, PRN. I am dose accurate at 0.8 mLs. Going to be giving it to her right now on her PICC line. And then I have Debbie Michaels, 5/18/2006. Ondansetron Zofran, 2 milligrams IV push every 4 hours, PRN. She's not gotten it. I'm dose accurate at 0.8 mLs for her 2 milligrams. I'm giving it right now in her PICC line. I'll set that over here so everything's set up. If she had caps on here per facility protocol, I would remove the cap. Taking an alcohol wipe. Going to scrub for 15 to 30 seconds, or per facility protocol. Take my first prime flush here, without contaminating the end. I'm going to hook it up. I will unclip, which there's no clips on here. It was clamped off. Unclipping it. I'm going to back draw until I get blood up in to make sure I have a patent line. And then I'm going to push through, make sure everything's flowing good, she's not having any discomfort,
Wash our hands.
to flush out the line.
And then we would go ahead, make sure that we have our tape.
And that went
data
through
make sure we
nicely.
have our
Clip off the
syncing,
line
make
to
sure
close it.
everything's okay, keep the
Unscrew.
ready to go. Everything's all
And grab a
right.
fresh
Make sure
alcohol
he
wipe.
doesn't need anything else.
These would all go in the
As always,
garbage.
make sure
I'm
that,
going to wipe for 15 to
it
30
still
seconds
needs to
or
be in
per
place,
facility
because if we don't have
protocol.
that foreign object in his body, it's just,
And I'm going to
an extra risk for
hook
infection.
up the
But he's
medication.
having chemotherapy, so he still needs to pick line in.
I want to unclamp,
Like I said
and
previously, if it was
the medication
something
needs to be
not
pushed in
well,
over 30 seconds. So
I would go in
I'm
there
going
and
to put the medication in over that duration. While I'm doing it, I want to be monitoring for any side effects, reactions,
and then I would
anything that
document
might be going
anything in Toronto,
wrong with the medication.
client tolerated it,
And
time.
medication
it
is
was
in.
done,
That was over 30 seconds. I
and
clip off the
time
line.
of what it needs to do.
Unscrew my syringe. Grab a new alcohol prep. Wipe again for 15 to 30 seconds. Second to my last flush. Clean it on. Reopening the clamp. Now I want to put in at least like the first 3 to 5 mils over the 30 seconds, or same rate as my medication, because there's still some left on the line. I want to introduce it at the same rate I was giving it, or I'm intended to give it. So we'll say I'm going slow to push the rest in at the same rate. And we'll say I've done it effectively at the same rate. The line is cleared out. The rest of my flush, then I can just push through. And I think I covered her allergy to hydromorphone, but that won't be a problem with the Zofran that she's receiving now. Clipping the line off again. And 15 to 30 seconds with the wipe. The last flush. Unclipping the line again, and then because this is a pick line, I want to do the pulse method to flush it through, which is just a mil per push, pulsating it through until all 10 mils are through. And everything flushed through fine. Disconnect, clamp my line. You can wipe the end off. If there are caps, steel caps on the end. Per facility protocol, I would need to reapply those, but I don't have those, so the line is clipped off. Everything is flushed through. I would dispose of all of my utensils, but because it's practice, I'm going to be saving those. Throw out all my wipes. Wash my hands. Take off gloves, wash hands, make sure the patient is in a position of comfort, have their call light, ask her if she's feeling fine, there's no adverse reactions to the medication. Come back, periodically check to make sure that it's actually having its therapeutic effect. Then I would date, time, and document my assessment findings.